Welcome and thank you for joining us for our Workday Chats today. I'm Keith Lowcamp, your host for today's discussion. If you have any questions, please share them in the comments below. So today I'm joined by Brad Buzik, CIO of MultiCare Health System, and David Chow, founder of David Chow Health. You know, everyone in healthcare is looking at how to do more with less. It's a lot of talk about digital transformation, technology innovation, artificial intelligence, and machine learning. And so today I'm excited to take some time today to talk about actually some practical examples of how we can help providers do more with less, and to hear from our experts about what IT leaders can do to minimize risk and accelerate value across these areas. So to kick things off, Brad and David, let's dive into the current landscape. So I want to start with you, David. You've been on both sides. You've been a provider CIO, but you've also been an analyst. So why is artificial intelligence and machine learning so critical in healthcare?
Thanks, Keith, and thanks for having me. I would say this year especially is so critical due to such extreme margin pressures that we're facing in healthcare that we're looking for ways to automate as much as we can. So automation to be more efficient operationally, automation using AI, ML to be more efficient from a clinical perspective. We hear tons of noise around clinical burnout. Physicians and medical staff are spending so much time doing documentation and administrative stuff. Now we have the technology that's here in front of us to be able to utilize that to automate their day a lot better. And at the end of the day, we want to provide the best care possible. And we also want the clinicians to be able to have the best experience while spending a lot of time and focus on patient care versus the administrative staff or task at hand. So I would say all that comes in play in terms of why this is such a critical junction time in terms of where we are using AI, ML, and any sort of automation to be more efficient.
Right. So a lot of challenges that potentially it could impact. And so, Brad, you know, you've worked across a variety of industries, consulting, public sector, not-for-profits. So what's your perspective on why AI and ML is so important to healthcare in particular?
Yeah, it's been really fascinating to watch how quickly I think AI and ML has cut through the hype cycle. And ultimately, it comes down to, I think, a show me, don't tell me capability. You know, who knows if this will age well or not. This is kind of the beauty of you know, real-time thinking. I actually think that this is going to be as disruptive as the invention of the internet. And I agree with my former boss, Bill Gates, in that statement. Why do I say that? We are so ripe right now because of the industry pressures to do more with less, to your point. And the stakes actually are higher now than they have been, right? Where we are full blown at closing services because we don't have staff to be able to staff enough nurses at the bedside to be with our patients. We have providers who are literally walking away from the practice. Mm-hmm. Why? Because they're not doing medicine, they're scribing. And so for folks like David and myself, our job is to reduce the pebbles in their shoes. And if we can do that through artificial intelligence, whether it's ChatGPT or any other new capability that relieves the pressure, I'm game to go try and get it wrong. Right, rather than not try at all. And this is where I think you're going to see the separation of the haves and the have-nots, right? I think in a world where our providers deserve these types of capabilities, it's on our leaders to actually bring these forward and try it. Is MultiCare going to get some things wrong? Absolutely. Is the autonomous robot that is learning the layout of the hospital I just rolled it out to running into walls? Absolutely. And guess what? Tomorrow I'll fix it, and it's going to be able to go now from the pharmacy to the bedside. Where a week ago it couldn't. And that's important because that used to be a nurse doing that. And now that nurse is at the bedside while the robot does it. So I'm bullish on these capabilities, frankly, for the sake of our industry.
Yeah. And so you make a good point about, you know, trying out a lot of different things, like it's a time of maybe experimentation of this to see what's going to stick. And so MultiCare, you're already doing some exciting things in this space. You started to touch a little bit on one of them. Can you share some of the innovations either on the operational side or clinical side that you know, might be a good case study or inspiration for folks on the session today?
Yeah, absolutely. I think first foundationally, and I just say this humbly, the only reason that Multicare is able to do this is because I've got operational partners that are willing to run as fast or faster than I can. If you don't have that, you're going to run a marathon with one leg. And what's been really awesome is that I'm being pushed, and in some cases I'm pushing, and that I think healthy tension has allowed us to speed up our innovation cycle and experiment. So, we'll talk about a couple of things. COVID was a really powerful excuse to knock down a ton of walls, right? I mean, we actually started running predictive algorithms to forecast our COVID census before it was cool to run predictive algorithms to forecast your COVID census, right? I mean,
Yeah.
and here was what was wild. We rolled this out, and for about a week, people questioned like, wow, how are you guys doing that? And then guess what? It started to prove out, and the forecast and the prediction actually mapped to the census. It then became table stakes. Then it was like, well, Brad, why aren't you guys putting out, like, when am I going to get my, predictive census for the day? So we changed the dialogue to not focus on like, well, does this work? Now it focused on, okay, well, now what about this? So this governance structure was born, Keith, that I think allowed us to not put governance and rails around it to slow it down, but to actually start to think about the other opportunities where you could leverage and get more out of capabilities like large language models. And how do you think about deployment of that for patient access, for, to David's point, allowing our providers to get some pajama time back at the end of the night. And those are some of the things that we've had great exposure to in the last probably 2 years, and had some pretty big wins.
That's great. And do you see, still see that sort of support to move fast, like, in responding to COVID? Are you getting that support then within the organization to continue to push the limits?
Yeah, I love that statement of pushing the limits. I'd say it this way, players make plays, right? And if you've got the right players within your nursing team and within your, physician leadership team that are willing to try things, suddenly an idea like drone delivery for a pharmacy at home doesn't sound like a stupid idea. It actually becomes well, Brad, when can we pilot? Or an idea for an autonomous robot. We've changed the culture, and the beauty of it, Keith, is I don't even know that we've realized we've changed the culture. It's just that IT's shown up as a thought partner as opposed to a cost center. And that's truly been, I think, the difference. So when we start to roll out statistics, right, and we are able to articulate, and this actually came out this morning, so this is kind of real time. We just turned on a new feature for pharmacy delivery to take it from the carousel out to the bedside, and we watched our delivery over in the Northwest increase by 40%. Wow. Literally overnight, because a robot can now do something that a human previously had to do. The really sweet part about that is it sparks the imagination to say, okay, well, what else can this thing do? And now my team is juggling a backlog of requests for cool things that take things off of our nursing team's plate, as opposed to, hey, my computer's too slow, can you fix it? Very different type of service.
Right, and it's definitely changing the dynamic with the rest of the organization by looking, to be a business partner with you. And so you brought up kind of the one of the initial hurdles was the trust in those predictive models, and we see that trust is really critical to the adoption of success with AI and ML. And so, David, as you think about trust and adoption of AI and ML, what do you think what does trust look like for clinicians, for patients, and for the business, and what do we need to do to be successful?
I think before we even talk about MI, ML, trust, I think what Brad's example at Multicare is the perfect example of innovation within, right? Most folks think you need to look external for innovation, but just by changing the philosophy, the mindset, the way they're doing meds to beds, which is I think that's how they're probably calling that initiative, that's innovation by itself. And the tool, the solution is great, but what's even takes it to the next level is the fact that now his organization is thinking about the art of the possible. So that is striving for innovation. And I think that's the foundational element for organizations that's starting to think about where they want to move towards. So where does MI or AI ML come in play with transparency? I think a lot of it's going to start with the data, right? They need the massive amount of data to be able to analyze, to be able to understand biases. With lots of discussion currently about the biases in the data, because let's look at various regions, geographical region. Multi-care may be in a region that's not as diverse as South Houston. So the data that multi-care has may be a lot different than what another organization in Houston has. So now we need to train the artificial intelligence, the ML, to understand, hey, this is geographical data from these various regions. There may be some biases components there. Now, can you take that and create some intelligence out of it? And it's going to take some time. I think we will make a lot of mistakes, but by being able to have that transparency, we saw some recent press releases where some of the big 7 big tech firms are coming together to create that transparency. Now, these are voluntary commitments, nothing set in stone as standards yet, but I think that's a starting point. But I would say the building block is what Brad had described at multi-care, which is that internal innovation that's going to create lots of transparency, that's going to create lots of thirst for innovation and try and do things differently.
Right. Yeah. I mean, so you made a great point about how Brad's kind of creating that that space in the organization to innovate. You also brought up just the questions a lot of people have in terms of, does the AI and ML, is there, what's the risk of bias in that? And so, at Workday, we've been focused a lot on being very active in creating responsible AI, sitting on national and international committees to help drive some standards. And you mentioned some of the vendors talking about that today. So David, as you've kind of looked at the space, what's your perspective on the Workday approach? And how do you think that will benefit in terms of driving trust and in particular supporting innovation in healthcare?
I would say having a shared platform across all your clients in a cloud environment is definitely critical. Let's move away from the Workday Cloud ERP example. Let's just talk about the healthcare security landscape, which is extremely hot. We all have problems with third-party vendors and what's happening there. But what's missing is a model similar to what Workday has built, where you have the centralized cloud model. Imagine we had a centralized third-party model to look at all the risks. That's going to help us, all the various healthcare organizations, identify potential risks without each organization trying to identify themselves. So I think the fact that Workday has a cloud environment that's transparent, bringing all the processes and the AI and the algorithms together in that fashion, that helps the industry tremendously. And I would say that's a key differentiator and a key mechanism and a building block that organizations can build upon and use it as a platform versus just a enterprise-wide software.
Right. So yeah, that ability to learn from customers really across the globe that are all using Workday, I think hopefully will lead to more diversity in terms of the data and lead to better recommendations and results. And so Brad, you just deployed Workday at Multicare. What are some of the benefits you are excited to see, and that could be AI and ML use cases, or just in general in terms of automation and the benefits of the platform?
Yeah, absolutely. I'll share with you some wild case studies, and these are probably feedback loops that I have probably taken for granted because I'd had exposure to Workday, previously. We've heard everything from "Holy cow, it just works," to "I downloaded the app and I can actually approve expense reports and supply chain orders on my mobile phone wherever I am," all the way to, "Hey, confession, I don't know my team's birthdays, and I just discovered that the Workday Assistant allows me to understand and remind me when their birthdays are, when their anniversaries are, and it makes me look like a better manager." all three of those are important. I don't put
Yeah.
any weight or judgment on any of them, other than Workday has certainly met our staff where they are. And if you're a new manager, you want to understand when your team's birthdays are. So I can reach out and say, hey, David, thinking of you today. Happy birthday. That goes a long way. And David doesn't know if it's my Workday dashboard that reminded me, or if I just remembered off the top of my head because I love David. And that's some of the kind of, I'll call it more softer benefits. From a straight up throughput perspective, we're just executing. I mean, in our first 3 weeks, we've literally run thousands of POs and recs through this. We've posted hundreds and hundreds of jobs. We processed hundreds and hundreds of applicants. Ironically, our very first applicant the day that we launched was a nurse, and we all clapped in the command center because guess what? We need nurses.
Nurses, yes.
I think there's a recognition though here, Keith, that there's we have new problems now, as opposed to, wow, we can't actually go and acquire another healthcare system because our previous ERP won't support it. I mean, it literally, like, technically wouldn't support an expansion, as opposed to now, wow, how do we take advantage of really powerful employee engagement through something like Peakon, which we've never been able to do technically. We always had a third-party solution for that I got to sunset and now fold that in. And so there's a really high level of optimism, even 3 weeks in. We believe that this has been a case study implementation and launch. We've already started on phase 2, which is bringing the learning management system in and moving to Prism Analytics, which I think will further unlock new insights for us across the system.
And I love hearing that story, just because what it also illustrates is that, that a lot of times there might be technology around opportunities that you could go after, but you're spending all of your time on kind of managing legacy technology, and by moving to the cloud now, hopefully freeing up some of the things that were taking up time, and really being able to innovate with the organization. And I hear that seems like your culture as well, is to innovate. And so, kind of thinking beyond this, and everyone's talking about generative AI in the enterprise.
Sure.
This is, I think I just mentioned it for the first time here. So we made it about 15, 20 minutes without mentioning generative AI.
You're ahead of the curve.
It's like chat GPT. They're very promising, but really need to be responsibly applied and understand what is that large language model they're based on as well. But then it also lets us, let our imaginations run a bit wild, right? In terms of thinking about what are those opportunities that this technology could unlock. So, Brad, I'm interested in just, hearing some of your ideas where you think this new type of AI could really help out, but then also, what are you concerned about as well as you think about implementing this?
Yeah, let me first maybe hit on what I'm excited about. I think, just quite humbly, MultiCare is more excited to go learn from those that have already gone before us on Workday, right? So whether you're talking about, St. Luke's and Ochsner, all the way to Bon Secours. Why? I think healthcare, while to David's point, is unique by geography. A GL is a GL, recruiting is recruiting, supply chain is supply chain. Operating off of a shared platform allows us to learn and benefit from questions they raise halfway across the country. So we're super excited about that. And I think that overarching pipeline and community of people that are pushing on the system the same way we are. I'm really excited about what I'll just call insights or suggestions that will be coming to my staff in ways that I could never staff up from an IT perspective to provide them those insights. So, if I think about in the finance module, for example, journal insights that just might automatically pop up, or anomaly detection. I don't have enough people, Keith, to go staff and sit next to our finance department to have them call out anomalies. And yet the platform theoretically should and could be able to do that in support of saving time. I also think about, automation opportunities inside of our supply chain model and in our purchase requisitions around spend category recommendations. These are things that we have really smart people on staff, but if the tool's prompting for just nudges and insights like, hey, David, have you thought about this for a tax attribute recommendation? That's the kind of insight that you're excited about. Where I would love to see it mature, and where I'm going to David's point in terms of like, how do we think about governing? This is true in our ERP. It's also true in the medical record system. The delineation between a curated large language model and an open source LLM like ChatGPT is where Multicare, I think, draws a pretty hard line. We most certainly want to give our providers opportunities to engage with large language models and have a ton of use cases for those, whether it's writing prior authorization letters to save them time, or automation of SOAP notes, to drafting quality response letters if someone raises a concern about the quality of the patient care. Today, they're all being done by humans. Right. Tomorrow, they could all be done through generative AI. How do you structure that, to David's point, in a way where you're mindful of the bias, you're mindful of the patient privacy and data security that you need in that LLM that today aren't HIPAA compliant?
Yeah.
And then how do you be transparent around how that model's trained to arrive at said prediction? And I think it's that magic that systems that lack the sophistication are going to struggle to support. I think systems that have the resources and, frankly, the brain power to go and do it will be further ahead, and those will be on the cutting edge of those that are uncovering insights for healthcare at large.
Right. Well, it'll be interesting to also see how that could become a differentiation for you, for a health system, as well as being a better place to work, as well as you've got the challenges with burnout, and a lot of that is because people feel they're being pulled away.
That's right.
Providing patient care for administrative purposes.
That's right.
Yeah, and so David, you hear all the great points that Brad's making, and where do you see organizations making mistakes today in their approach to leveraging AI and ML, and what advice do you have?
I think the only advice is do not be scared. I think the example that Brad just gave, most folks are not bold enough, right? I had the privilege of talking to Brad and a slew of other executives who are like-minded, and we're all talking about the same thing. We're all tackling the same problem. But in the end, there's only a very few group that's willing to be bold and take on and try something different without it being proven out. So I would say that's the biggest difference when I see large-scale organizations that are successful with prominent leaders like Brad and others, is they're willing to make that bet. It's calculated, of course. They're not just doing it without any background information, but they're willing to be one of the early adopters. So I would say that's the mistake that organizations are making. They're not being bold. They may not be relevant. They may not be able to stay competitive versus some of the peers. And that's what I'm seeing in terms of the AI ML is, who is going to be the first to try it? Who is going to block all the noise about privacy, security? Yes, there are challenges. It will not be perfect, but are we able to work with the imperfection to move forward? And the same about HIPAA. This is a very bold statement I'm going to make. We're always trying to adapt things to HIPAA that was written a long time ago. What about if we start modifying HIPAA now to adapt to the new technology and flip that script a little bit more? So I don't think that has been in discussion as much, but I would say that hopefully gets people to think a little bit different, to challenge the status quo and just be bold. I think being scared is probably the biggest mistake that organizations can make.
Good, so Brad. I'm sure you'd agree with the being bold statement, right?
I do.
Yeah. So, but being bold, how do you bring along everyone so that they're rowing that same direction? How have you managed to kind of help bring the organization along?
Yeah, I think in some cases, again, it's, I think, earning the right to be heard. And this has not been an overnight deal. I think for years, IT at Multicare, and I would say IT probably writ large, as David mentioned, we talked to some of other colleagues around the country. The variance in the system is different. I mean, relationships between IT and the business vary by leader, they vary by region, et cetera. I think when you can roll out capabilities like Workday that unlock other capabilities. So let me give an example. Now that we're on Workday, I could actually take advantage of something like Workday Extend, which allows me to bring in ideas from our frontline staff and wrap AI around something that might be their baby. And they watch their idea come to life, and IT enabled that. That's the difference between being an order taker and a partner. And so I get excited about those types of capabilities. To David's point, though, this isn't a journey for the faint of heart. It's also, I think, requires a level of executive sponsorship and fortitude. You can't get halfway into this and decide, our census is too high or we're low on cash on hand, so we're just going to stop. We pushed our chips to the middle of the table on 3 fronts in 2020: Access Center, ERP, and Epic. We completely gutted our Access Center and moved to a cloud-based platform that's killer. We rolled out Workday, and we went from 3 stars on Epic, and we will be 9 by the time I'm done. And multi-care looks incredibly different as a result. The way we work, the way we partner, the way we talk. And that's easier said than done. What you don't see is, like, I had hair before I started that journey, Keith, but it's absolutely worth it because it's better care and it's a better way to work for our staff. And so folks are excited about the new horizon that we're coming upon.
Right. And so then, David, what is the most important investment a CIO can make today in terms of technology solutions or partnerships to help set them up for success in this rapidly changing world? I mean, basically to be bold, like you mentioned.
I'll say 2 things. First would be, as an individual leader, we have to understand the business operation model. What do I mean by that? We need to understand supply chain, revenue cycle, coding, equivalent to our peers who are in that space. I would say at the moment we only think about the tech side and not understand the business problem and understand that world, we're not doing our job. And that's really hard for many CIOs to grasp. Very few can explain a patient journey from start to finish and all the various details and nuances. But we must understand that to be effective with all the technology solutions. So that's number one. I would say second, we need to stop thinking about technology vendors as just transactional. There's got to be some table stake in place. The partnership model has to be in place where both parties need to have some skin in the game. So I don't see a lot of organizations where they're either buying a technology partner or buying an implementation partner. But maybe it's time to think about that, because we're trying to do with our internal staff who are only very good at managing the current portfolio. The moment you start throwing something new, what do? We start looking for external resources to implement. Why not think about how to make that investment to become a external technology partner, maybe own a piece of it so that they could be part of your internal operation? Very easy for me to say, very hard to practice due to all the red tape, the political landscape. But the prime example, one thing I'm trying to do at Legacy Community Health is I have established a separate entity called Legacy Innovation Systems. And the sole mission is to be able to do that. I want to be able to co-create, number one, co-create and commercialize products. Number two, if the opportunity arises that we have these large scale implementation and maybe I get to to be able to see the vision of technology as a service provider, I get to maybe acquire a partner to be able to do some of these stuff externally and internally. So that's something I would say I'm going to challenge organizations and leaders to think through, because at the end of the day, you're paying that dollar to the external consultant firm somehow, but you're not reaping the benefits of it other than that one transaction that's in place. So something just to think about in terms of how you could differentiate the various investments, both internally as a leader and organization.
That's really interesting how you're bringing more of those capabilities in-house and be able to support even more innovation potentially within your organization. So it's a fantastic discussion. So just to wrap up, I'd love to get a quick thought from each of you on what you're looking forward to, like what most excites you about the future of healthcare. So Brad, if you could start.
Yeah, when I think about the future of healthcare, I get most excited about the new summit that we can now go say yes to, where things natively talk. And I'm still pushing heavy on my friends on the EMR side to become a little more open so we can have a little more things that talk to our EMR. But I've got an awesome system now on the ERP side of the house that by way of interoperability can talk to anything that Multicare wants it to talk to. And I'm really, really excited about that. To David's point, we also just leveled up the skill set of all the staff that were engaged in this project. This wasn't an IT project, it was a business project. And so we've raised up Workday subject matter experts in supply chain, finance, and HR. They don't even sit in IT, which I absolutely love. And so we are a convener of leaders at this point, as opposed to all the expertise sitting in-house. And I think it's that distribution of expertise that's going to allow us to actually go faster on our merger and acquisition strategy when we need to go bring on a system. I don't have to wait 2 years anymore. We're going to be able to roll them on really quickly. And so I'm excited about that speed to market now.
Right. Sounds like they've got the skills and they're also more empowered to
Very
take
much
action
so.
as well. Right?
Yeah, very much so.
And then David, what are you most excited about?
I'm excited to see that organizations are finally realizing that they are a digital company in the healthcare world. I mean, the example that Brad just gave is Multicare is now a digital company. They're just specializing in healthcare,
That's
in
right.
that healthcare ecosystem. But the core is really all the various digital products that he has. Imagine one of those fail, operation goes down. So most organizations starting to realize, hey, we have to transform to become a digital company in our vertical. So starting to see that, very excited and very bullish on that.
Yeah, and for me, I'm excited to the possibilities of the technology and what we're able to deliver, not just to impact the mission of healthcare and help help support the having sustainable margins and drive greater efficiency as well. So it's great to kind of see this technology come to fruition and really impacting your day-to-day operations. So, thanks for sharing your insights, Brad and David. Really appreciate your time. For more on this topic, join us digitally or in person at Workday Rising, September 26th through 29th. So have a great workday.